Now, Mr. Gilbert, I wanted to ask you about how you have, in Victoria, managed to involve ratios in enterprise bargaining. How has that come about?
In terms of private aged care?
Yes.
Well, we've only achieved it with three approved providers. And I guess they have been approved providers who were prepared to step out into the light. I don't mean that in the way it sounded, but it brings some. I'm sure some of the other employers weren't too pleased that they did it, but so TLC included what are reasonable ratios, not good ratios, but certainly a lot better than other staffing levels we have seen.
How do they compare to the public sector ratios in this state?
They're quite comparable except on night duty, and they don't include the in charge. So when they say 1 to 7, 1 to 8, 1 to 15 in that agreement, that includes the nurse in charge of the shift. In the public sector, the nurse in charge of the shift is in addition to that.
Right. And what's the night difference?
I think it's 1 to 22.5 versus 1 to 15.
Now, is that going to be a negotiating tactic that is pursued by your union across Victoria in the future?
We've pursued that in every enterprise agreement. It's just that these are the only three that have agreed to do anything reasonably concrete. We have preserved the 24-hour registered nurse cover in almost all of our enterprise agreements, but you've got to keep in mind that when that was put in the agreement, we had one registered nurse every 30 beds. Now we've got one registered nurse every 100 beds.
Yeah. What's your success rate for the three? How many have you gotten nowhere with that sort of?
At 157. I think there's about 180 enterprise agreements in Victoria, private aged care, and we've got three that have something beyond 24-hour registered nurse cover.
Is there a prospect of including a clause along these lines in the modern award, Mr. Gilbert? Is that something that's been considered in any action you take to amend the modern award?
We don't think that would be something we'd get successfully put into a modern award. Yeah. No.
What's the barrier for that in the modern award context?
The modern award considerations that the Commission has go to things like, to use capital E, efficiency, productivity, flexibility, everything that counters against having some mandated staffing level that was meaningful.
Why doesn't the Commission have anything or anything to add to the equation about the safety of the patients?
Well, they wouldn't see that as their job. That's the job of the Commonwealth in this particular circumstance.
How did the Bupa industrial action end up?
What was the outcome?
Yeah.
Not nurse to patient ratios, I can tell you that much, and that was a bit of disappointment to members because that's, to be honest with you, all they really cared about.
What was the issue that they took action about?
The context at the time was that there'd been a couple of quite poor agreements proposed by Bupa without consultation with us, so just gone out to members. And then they introduced a proposal to substantially cut the registered nurse workforce. And that triggered...
By how much?
It was, in Victoria, 23 positions.
Was that across all facilities?
Yes.
The same reduction in each facility in Victoria?
Proportional to the bed numbers, more or less.
Just to bed numbers?
Well, they had... The EFT of the positions was proportional to the size of the facility. So it was actually, I think, 70-odd positions that were being made redundant, but about 40 of those or more were going to be able to be redeployed. So there was a net reduction of, I think, 23 registered nurse positions. And from everyone from carer to enrolled nurse to other registered nurses knew that that was not going to be something that they were going to be able to cope with. Yeah. And so that probably triggered their angst more so than anything else.
And what was the end result of the industrial action?
They didn't get those positions back. We had to, I don't like the word sell, but I guess it's the only way you can describe it, that the only way we're not going to get ratios out of the likes of Bupa. If we're going to get ratios, it's going to have to happen at a Commonwealth level. I think the Commission has had so much, it's really sort of dawned on me more and more in the last few weeks that staffing levels are currently set by reference to the Stewart-Brown report, I've decided.
With reference to what?
The Stewart-Brown report, it's a firm of chartered accountants, I think, who take data from about 900 aged care facilities, and then they send that out to their clients, and you can compare how much you spend on meals compared to another facility, how much you spend on care compared to another facility. And when I've been looking, which I've had the obvious pleasure, fortunate to be able to do so, at the statements of people and the evidence before the Commission, is that they use that to decide whether their care is at the right level. If I'm sitting at this comfortable level that's kind of like most other people, that's good enough. And that's the benchmark they're now using to set staffing levels. Whereas, and then we're copying criticism about ratios being a blunt instrument, when what they've got now couldn't be more blunt. It's just comparing, I'm not as bad as that person, and in the event that I have got higher staffing levels, then my directors are going to come down on me and make me drop them. And I think you've seen that evidence quite vividly. Ratios have, we have nursing hours per patient day in a number of states in various areas already, and we're advocating for a case mix based funding system that is linked to mandated minimum nursing hours per patient day, which includes a skill mix of personal care staff and nurses. That will turn into a ratio. It's just the nature of the industry. And a ratio is simply X number of staff for X number of beds. There's already ratios now, they're just dreadfully low. So if we implement ratios, the benefit of that, of course, is it sets in stone that that money is for care and that care will be delivered and there's no gaming opportunity. The 5-star system haunts me a little bit. I can see the initial attractiveness of it. But as I said, the employers currently compare with each other what is an acceptable level of care. They could drive that star level down through that comparison process, and then we'll end up back where we started from. I'm also fearful of doing any more long-term background work, because I think we've said in one of our statements, it's time to stop kicking the can down the road. We've had 20 reviews in 20 years and things haven't been implemented. Sending things off for another review or having a marketing program to improve the image of aged care, seriously, it's time things were put in place, and we know what needs to be put in place, and we need to make it unambiguously uncomfortable for the Commonwealth to put those things in place.